Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Hodgkin's lymphoma, also called Hodgkin's disease. So what is Hodgkin's lymphoma? Hodgkin's lymphoma is a malignant disorder of lymphatic system characterized by the presence of multinucleated giant cells called Reed-Sternberg cell. It has bimodal distribution, common ages, or usually it happens between the age 15 to 35 or maybe after the age of 50. There is genetic susceptibility. It is found that in monozygotic twin study that there is gene has significant role in the etiology of Hodgkin's lymphoma. It is more common among the males. Incidence is 4 per 100,000. It occurs in all races. The exact cause is unknown, more common with history of Epstein-Barr virus infection or history of HIV infection. Clinical presentation is also very much variable. It may begin as painless enlargement of the cervical lymph node in the posterior triangle of the neck. Posterior triangle is the area behind the sternocleidomastoid muscle. It may also begin with, in addition to the cervical lymph node, or maybe independently from the axillary or inguinal lymph node. So all these lymph nodes may be enlarged, but mostly it is first noticed by the patient cervical enlargement of the lymph node. Okay. Progressive, that means more and more lymph nodes are involved, form, sometimes mated, rubbery consistency with asymmetric distribution. Symptoms may include fever, night sweats, weight loss, malaise, patient becomes fatigued, pain in the lymph node associated with alcohol intake even after a shower. There may be chance of pruritus because of high eosinophil count. Other association may be superior vena cava syndrome and erythema nodosum. Differential diagnosis of Hodgkin's lymphoma. This include non-Hodgkin's lymphoma, sarcoidosis, Epstein virus infection, cytomegalovirus infection, toxoplasmosis, HIV infection. In non-Hodgkin's lymphoma, we will not get Reed-Sternberg cell. So, one of the differentiating point between Hodgkin's and non-Hodgkin's, it will not get in non-Hodgkin's lymphoma any Reed-Sternberg cell. And also mesenteric lymph nodes are mostly involved by the non-Hodgkin's lymphoma. The WHO classification, WHO means World Health Organization, classification of Hodgkin's lymphoma are number 1, nodular sclerosis, number 2, mixed cellularity, number 3, lymphocyte rich, number 4, lymphocyte depleted. This 4 is called classic Hodgkin's lymphoma. Classic Hodgkin's lymphoma. We have another type, non-classic Hodgkin's lymphoma, that is nodular lymphocyte predominance. Clinical staging of Hodgkin's and non-Hodgkin's lymphoma by Ann Arbor classification. Stage 1, one lymph node involvement. There may not be an extra lymphatic organ involvement. Maybe one organ involvement. 2 or more lymph node involvement, there may be a localized involvement of extra lymphatic organ. Okay, stage 3, involvement of lymph node on both sides of the diaphragm. with or without involvement of the localized extralymphatic tissue. Stage 4, diffuse involvement of the extralymphatic organ with or without lymph node involvement. We may also these four, again two more classes. One class with no symptom, B symptom, that is with symptoms. So this is a histopathology will give emphasis on the Reed-Sternberg cell, also called owl eyes appearance cell, like the eyes of owl, okay, large eye with big nucleus with inclusions, okay. This is the Reed-Sternberg cell or owl eye appearance cell. We'll get another one, it may not be binucleated, maybe one nucleated. We'll get reactive lymphocyte, we'll get also eosinophil, macrophage, plasma cell, stromal cell. Okay, so this is the giant cell and it is the tumor cell, giant tumor cell, and it will invite the cell to come here, okay, to enlarge the lymph node. It also releases cytokine, okay, a protein. So this is the histopathology. We have this classic type of Hodgkin lymphoma has Reed-Sternberg cell with little different histoimmunologic characteristic of Reed-Sternberg cell than that of non-classic Hodgkin's lymphoma. Diagnosis is confirmed by lymph node biopsy. Sometimes we also need to take the bone marrow specimen to find out Reed-Sternberg cell, but lymph node biopsy is the gold standard. Other workup, chest radiograph, both view, CT scan, computerized axial tomography, this should be a capital T, okay, so this should be a capital T, so CT scan, CBC, ESR, ESR means erythrocyte sedimentation rate, BUN, blood urine nitrogen, and liver function test. This should be done. Liver may be involved, spleen may be involved, bone marrow may be involved in case of Hodgkin's lymphoma, not only the lymph nodes. And cervical lymph node is the most common lymph node, that is the abnormality that is first patient may discover. She has enlargement of the cervical lymph node. Okay, it may not be confined to one lymph node, maybe multiple lymph node, maybe one side or maybe in the other side. Okay, it may be both sides of the diaphragm, that is also possible. And not only lymph node, extra lymphatic part of the body may be involved in Hodgkin's lymphoma. Treatment by chemotherapy, multiple chemotherapeutic drug is given. Okay, idea is that chemotherapy, multiple medication is given, but we must to consider a lot of adverse effects, loss of hair. Also, there will be mutation in the germ cells, and there may be chance of more congenital birth defect. There may be secondary carcinoma due to chemotherapy. Radiation therapy is less emphasized than chemotherapy, but radiation therapy is also a problem. There are changes in the skin, and again, there may be possibility of secondary cancer. We must remember that a person with Hodgkin's lymphoma is more susceptible to develop lung cancer, malignant melanoma, and maybe chance of breast cancer in female to the patient who has Hodgkin's lymphoma. Treatment, chemotherapy, radiation therapy, also bone marrow transplantation to replace the stem cells. Okay. So these are the highlights on Hodgkin's disease. Unusual tumor of lymphatic system with reactive lymphocyte, eosinophil, macrophage, plasma cell, stromal cell, mixed with Reed-Sternberg cell. This is very important. Reed-Sternberg cell is only present in Hodgkin's lymphoma. In non-Hodgkin's lymphoma, there is no Reed-Sternberg cell. Enlargement of lymph node. It may be the mediastinal lymph node, cervical lymph node that may lead to superior vena cava syndrome. There may be erythema nodosum. Reed-Sternberg cell is a tumor giant cell. The source of the cell, it is told nowadays, it is coming from the B lymphocyte in the germinal center of the lymph node. Signs and symptoms, we must know the signs and symptoms. We may have weight loss, cervical lymphadenopathy. Okay, there may be pain after alcohol intake. There may be abdominal pain. Okay, so there may be sweat at night, fever. We call pale abstinent fever. There may be periodic fever. There is a possibility. These are signs and symptoms. Who and Ann Arbor classification. Okay, and we have symptom on Ann Arbor classification. Absence of symptom, that is A type. Presence of symptom, B type. This is according to Ann Arbor classification. We have to study the histopathology. Again, we look at the reactive cells and also the Reed-Sternberg cell. Diagnosis definitely by lymph node biopsy, maybe bone marrow biopsy. We also do CT scan, MRI, liver function test. Okay. Even we may do the bone marrow study. Diagnosis. Treatment by chemotherapeutic agents, multiple chemotherapeutic agents. There may be radiation therapy and also bone marrow transplantation. Okay. And that's all about the Hodgkin's lymphoma. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.